protectors of the Sunnah followers, protectors of the Sunnah.
Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah wa salatu wassalamu ala Rasulillah sallallahu alaihi wasallam. My dear brother and sister, we're supposed to speak about family issues, but in fact we're going to speak about family also. But this time we're going to speak about the most important topic, and that topic, in fact, why? In fact, before my sickness, I used to have my health insurance. I used to pay more than $1,000, more than that, every month. And then, almost 4 years ago, I met his mom, Tracy. And when me and my wife would sit with her, and I found out I can have free insurance, Obamacare, because I was not working at that time. So believe it or not, I have his mom make the insurance first with him, and then after that, when I got my insurance, I travel with him different states, different masajid, khutbah al-Jum'ah. I give lectures and also inviting other people to make the insurance. MashaAllah, we did many. In fact, when I become an imam here, I invite him to come to give insurance for everyone. And also, my dear brothers and sisters, online, I just put the ad for many states, not all United States of America for insurance. They can be how many states around?
We work with over 25, 30 states, so we're all over the country.
Any question, you can text us, or you can tag the ad in Facebook, the flyer. You can contact their office. And then Johnny, please, Johnny, welcome to South Carolina.
Oh, thank you. Thank you for having me.
You're welcome.
Okay, so my home office is actually based out of Texas. We have offices all over the United States. I have offices like in Dearborn, Michigan. I have offices, I'm opening up a couple in Georgia here coming soon. And basically what we like to do is we like to help everybody apply for any type of assistance to help pay for healthcare. If it's one, maybe we help people apply for the Obamacare and get tax credits to help pay for their insurance. Or for people who make too much money, there's other types of assistance out there as well. We also help children, because a lot of children actually apply for state assistance. They are qualifying for the Medicaid. We help people apply for their children for Medicaid if they qualify. We also help with people who are older, over 65 years old, that can apply for Medicare, where they get assistance from the government with Medicare. So we specialize in helping people find solutions to get access to healthcare, no matter what their income looks like or what their family size is. So right now, we're actually in the open enrollment time for what people like to call Obamacare. And all Obamacare is, because a lot of people get confused on what Obamacare is. It's regular health insurance. Health insurance is really expensive, but we apply for subsidies from the government to help us buy the health insurance for us. And not only does it help us pay for the premium, that thing that we have to pay monthly to have it, but it also helps us pay for our doctor visits. A lot of my plans that I have to offer people cost nothing a month, depending on what your income is, but also costs $0 to use it whenever you go to the doctor. And a lot of the prescriptions are also zero as well. Plus, it gives you assistance for if you end up hospitalized. It gives you protection, because a lot of people go to the hospital and they can end up racking $100,000, $200,000 in bills very easily. And the insurance or the state assistance that we apply for will help limit that, where it couldn't be any more than like $1,000, maybe $1,500, depending on which plan we go to. We also, another reason to talk to people like me instead of trying to just go apply directly with the insurance companies. One, I understand how the income works and I can explain the income to you where we can get it at the best price. But also, one of the problems with the insurance companies that people have to deal with is when they apply for these insurances and they go and try to use it, sometimes there's miscommunication between the doctor or the hospital and the insurance company. So sometimes we enroll people and they see the benefits and it looks good. Then they go to the hospital or the doctor and the doctor still charges them even though what we showed you is what you're supposed to pay and they charge you differently. What my job is and why we want to become friends with each other and you take our number down is whenever the doctor or the hospital bills you or they overcharge you than what you were supposed to pay, you're not supposed to get upset with the insurance company and think that, they're doing you wrong. You come find us and we help you fight with the insurance company or the doctor. Because I've seen it both ways. Sometimes it's the doctor or hospital billing the insurance company wrong. Sometimes it's the insurance company denying it when they should accept it. So we go on your behalf and help you make sure that the insurance companies or the doctors are not charging you more than they're supposed to. Now, as far as those tax credits that I talk about, a lot of people are qualified and they don't even realize that they qualify for them based off of their income. A single person can make up to $54,000 a year and qualify for these tax credits to help buy their insurance for them. A family of 4 can make up to $111,000 a year and qualify for these tax credits to get these low-cost plans. So everything depends. It's hard for me to send out a blanket statement and say everybody pays this exact amount because it's all variables based off of your income, okay? So what the best way of us finding out is I can have applications for anybody that's needing the assistance. And by these applications, we can go deeper and determine exactly what you could qualify for based off of how many people that are in your family and how much income you make as a whole. And then also we break down and see what doctors or prescriptions you take because all these insurance plans cover the prescriptions. So but some of them cover them differently. Maybe one company charges you $0, but then the other company charges you $50. We help you find the one that covers it for $0 along with the doctors. We got to make sure that this insurance company works with your doctor because just because you sign up on insurance or you're getting assistance from the state, that doesn't mean that the doctor or hospital that you like the most is going to take it. We have to make sure that doctor or that hospital is going to accept the plan that you're signing up with. And then there's also a few other things that we would need to explain, like what the difference is between the HMOs and like what people call the EPOs. So like if you sign up on an HMO plan, even if you go direct and you're not working with my office, it's important to know if you're on an HMO, you have to go to your family doctor or your primary doctor to get a referral to the specialist. So you can't, if you have a heart issue and you sign up on this insurance, you can't just go to the y'all's local cardiologist and see have him try to see you. Even if he's in the network, you have to first go to the family doctor or the primary doctor and have them write you a referral to see the specialist. If your plan says it's an EPO, that's not the same. That one you can actually go directly to the cardiologist without having to see the primary care doctor. Okay? Like he was saying, we do work in multiple states, lots of different states. Every state's a little bit different. Here in South Carolina, we have a lot of assistance. It's pretty good. We can get help from the federal government. Some of the states, like if we have people on here watching that are like in New Jersey, maybe Colorado, California, they have their own state-based exchanges. They have assistance that's coming directly from the state. So we actually go on and we help you apply through the state to get that assistance, like what we do here for the people through the federal government. Okay? I guess I'm going to open it up for any questions that any of y'all may have that are here with me.
Which better, Texas or South Carolina? As far as the federal assistance?
The assistance is the same. It really comes down to county based. So how much assistance that we get from the federal government? Well, these are both federal states. So how much assistance the federal government pays us to help us buy our insurance comes down to what county you're in. So The way it works is the government looks at all the insurance companies that are in your county that offer insurance, and they base how much money they give you based off of who the cheapest company is in that county. So like in this county that we're in right now, let's just say that it's $500 a month is the cheapest insurance company out there. And then in Texas, maybe my cheapest insurance company is $250 a month. The government is going to come in and give us enough assistance to pay for $500 a month here to make it affordable for you. They'll pay the full thing for you. In Texas, maybe they only give me $250, but at the end of the day, what we maybe you get more help here than I do there. What we look at and what we pay is going to be the same. Does that make sense? Yeah. Okay.
But there's just for I don't have to go through the general doctor to go to cardiologist, for example, or kidney doctor. Mm-hmm. Can I go straight to the kidney doctor or cardiologist?
It just depends. So if you're wanting to go directly to the doctor, like a specialist doctor, not a family doctor, like I was saying earlier, it really just depends on which plan you're on. If you're on an HMO plan, you have to go to the family doctor or the primary doctor first, and then they write you a referral to the specialist. If you're on a plan that we call an EPO, you could go directly to the specialists. HMO, it means Health Maintenance Organization. Basically, they run everything through your primary care doctor, your family doctor. They want to make sure that everybody goes to that family doctor, and then if that family doctor can't help you, he's what we call a gatekeeper to the specialist. He's the one that sends you to the specialist. And the reason that they do that in their defense is they're trying to save money as an insurance company. To them, they don't want a bunch of people just thinking, oh, I looked on WebMD. It looks like I'm sick with this. I'm going to go see this kidney doctor. And then you get to the kidney doctor, and the kidney doctor charges the insurance company and says, nope, you don't have a kidney issue. You need to go try out a different doctor. So they want to send you to the primary care doctor who can help diagnose you and send you to the appropriate doctors. Even though sometimes it seems like a hassle because maybe no, I have a heart problem, or obviously this thing growing from my skin needs to be seen by a dermatologist. Overall, the insurance companies try to run everything through that primary care doctor on the HMO plans. EPO plans are more open to you being able to access the doctor. Now, we work with all the different insurance companies. So if there's it doesn't matter to us on who I help you with. We really look at who's going to treat you the best. Okay. Mm-hmm. So like one of the companies here that I saw is called Cigna. Cigna is really good. They're a little bit newer to South Carolina. So to me, what that means is it probably has less doctors than like Ambetter, who's been here in South Carolina for a longer time. But there's some benefits. I mean, it's cheaper monthly to buy it. So if you don't really care, it's a good plan if you don't care about who your doctor is. And then also like diabetic supplies. If you're wanting to get insulin with Cigna, it's only $25 per month. So, I mean, that's pretty good for paying for insulin, where you only are charged $25 a month.
Yes, you said Cigna, like what's the lowest income they can go with?
So, if to get it for zero cost, where you pay nothing a month for Cigna, if you're single, you have to make less than $20,000. If you're
married with 2 kids,
so a family of four, $41,000 or less, you get it for free. You pay zero for it.
if you make over $41,000,
If you make between 41,000 and 69, or I'm sorry, if you make between 41,000 and 55,000, it will cost you $650 for the whole year. If you make between 55 and 69, if you make between 55 and 83, it costs you $1,600 for the whole year. Okay? If you make for the whole year total. If you're between 83 and 111, it's $2,700 for the whole year. But that gives you what we call a $0 deductible and a $1,000 maximum out of pocket. Okay? So after $1,000 on medicine, $1,000 on doctors, hospital, anything, if it ever adds up to $1,000, the rest of the year, everything's free. That's your maximum. It costs you nothing to go to that primary care doctor. It costs you $5 for a specialist visit. Okay? But and they charge you a percentage if you're in the hospital, but everything adds up. And once it reaches $1,000 out of pocket for the year, everything's free after that. No more pet copays on prescriptions or doctors or hospital.
And see, now you know, like what you're talking about. Discover, like, you know, dentist too.
No, that's a good question. So these health insurance plans that we're talking about, they do not cover anything but medical. They do not cover dental. They do not cover vision. So what we
Vision
do,
too?
yeah, no vision. No, it only does medically necessary things. So if you have, I mean, dental, like if you got in an accident and you're in the hospital, yeah, they'll cover the dental. But if you're just going in because you have a hurt tooth and you want to go get it checked out by a dentist, no coverage. It's only for emergency. So there's plans available that you can get to help pay for the dental or the vision that are separate from this, and we could talk about it that at another time as well. But as far as the health plans themselves, they do not cover it, okay? Personally, I'm not a huge fan of dental insurance because you pay monthly for it. Like, let's just say you pay $40 a month for it. Any major work that you need to get done, you have to wait like a whole year from whenever you start paying for it. It only covers like the basic checkups for the first year. After a year, if you got major work done on it, a lot of them have maximums that they will help with. So like I was saying on the health, there's $1,000 maximum out of pocket, and then you're done and the insurance company pays the rest. It's backwards for dental. They'll put like a $1,500 maximum that they help with. After that, you pay the rest. So I'm not a big fan of dental insurance. What I like to tell people is either we find a dentist that can offer it at a good rate, and like we make friends with that dentist, or go to Turkey.
Actually, my doctor, dentist, either Turkey or Mexico.
Oh, yeah.
Cheaper.
Yes.
Yeah.
I used to have signal.
Yes.
Okay, I used to have signal, you know, and use cover, you know, like a dentist and
Was it from work?
yes.
Yeah, so what I'm talking about, completely different than work insurance for dental. Work insurance for dental is good. If you try to buy it on your own, it's not good. And
Makes sense.
I'm an insurance agent. If I sell it to you, I make money, and I'm telling you, don't buy it. So, I mean, I don't believe in it. I don't like it. I only like to help people with things that actually help them and is good for them. And that's something that I don't believe in.
In fact, John and his mom, many masajid I know in Texas, and especially in Texas, many masajid I know that Texas, I work with them, help the masajid financially. In fact, especially in Ramadan.
Oh, yeah.
Especially in Ramadan, yeah. So this time in our masjid here, inshallah.
Yes.
If you come in Ramadan, you'll be perfect. You can meet a lot of people here.
Oh yes, that's right. Yeah. I mean, more people come in Ramadan, a lot more. But Ramadan
And some good food, too, no?
Absolutely. Absolutely. Huh? Yeah, Maris. The end of Maris, the آخر Maris. The 23rd. Yeah, inshallah. Inshallah, we'd love to see you at least, not on insurance, to eat us. Yeah. Yeah. Actually, Jan and I went to special restaurant. He go to Arabic restaurant, special Arabic restaurant, and he has a passion of the Arabic food. Really, passion of the Arabic food.
Oh, yeah.
So, brother, online, who are on the online, please go to, I just share the flyer, Arabic and English. Go and call the office straight. And even here, I told the people, many people come here. If you call the office, they are all kind of languages, Arabic, English, Moroccan, maybe some people.
Oh, yeah. Yeah, no, so like our office, we support all the different languages.
Yeah.
You could call me, but it may not do some people good because I only speak English. At my office, we speak Urdu, we speak Hindi, we speak Arabic, we speak Somali, we speak
Here,
many different languages. We have Pashto, we have people from all over. We like to help everybody.
Yeah. So very important, brother and sister, online, go online to the website, or the phone number in the Facebook, you can find inshallah, and call, and make sure they are open. From what time they open?
We are open from 9 a.m. to about 8 p.m. Central Time.
Central time, inshallah.
Yes, and we're open 7 days a week right now. So anybody that needs help, you feel
7
free to
days.
call,
Yeah.
talk. We have a Facebook page that I'll give to you.
Oh.
We have a messenger on there. So if you want to message and ask questions, we can talk through messenger.
Great.
And we speak all languages on the messenger as well.
Inshallah. All right, so any questions?
Yeah, one question. So today we are like December 10th. So when you talk about income, is the one for like this year or for the...
Oh, very good question.
Yeah.
So the income when I talk about income, the income I'm talking about is actually a prediction of next year. So we're going to guess next year's income.
Yeah.
So it has nothing to do with what's going on currently.
Yeah.
And another good point that I want to make that I don't think I made is on all of these insurance plans, when I talk about networks, one thing that doesn't matter is emergency. If you ever on any of the insurance plans and you have an emergency anywhere in the United States, if you have to go to the hospital, you are covered. These insurance plans will pay for an emergency. So if you're traveling and you have one of these insurance plans, you could be in Alaska and go to the hospital, and that hospital will cover you and pay for you as an emergency. And they also all cover urgent care. So the urgent care clinics, they'll accept you inside the urgent care clinics. When I talk about network, making sure you stay in the network, it's more about the primary doctors and the specialists. And if you have to go to a hospital for like a surgery, like if your doctor says you need to get a knee surgery at this hospital, or they want to admit you into a hospital, you want to make sure that that hospital is in network.
Okay, for another question, for Obamacare, so you know, open and close, what about your insurance? You can start anytime?
So right now we have November 1st to December 15th for a January 1st start date. And then from there, they have it until January 15th is what they're advertising. Truly, if anybody needs help throughout the year, they can contact me and I'll be able to help them. I can help all year. And but the thing is whenever I help somebody, the soonest it can start is the first of the next month. I can't have it start immediately or backwards.
We have insurance and after March is expired, and you want to start new insurance. You can call you can...
Absolutely. Yes, I can help.
It's happened to my kids, actually.
Yeah.
Yeah.
But with these subsidies that we receive, one of the things is if you are offered insurance from your company and that insurance is less than 8.9% of your income, you're supposed to take it from your company. You're not supposed to take the government money. And the reason I tell you that is because if you take the insurance and you're offered it and it's affordable from your company, what could happen is whenever you file your taxes, the IRS can come back and make you pay back some of that assistance. So if your company offers it to you at an affordable rate, it's best to keep it from your company. And plus, sometimes the company insurance is really good. Sometimes they offer PPOs where you have complete open access on doctors, where we're a little bit more limited with these type of plans. Okay?
In fact, yesterday some brothers told him after khutbah al-Jum'ah, our dad said, no, your company is better than here.
Yeah.
He was very honest. Yeah.
Yeah, I'm not interested in trying to take somebody off of something that's better than what we offer, because I really like the plans that we have. I don't think they're terrible. I think that they definitely have a need, but I think that sometimes they could be people that are getting insurance from work, or if they're children getting insurance from the Medicaid. I think that's better than what we have because it costs less sometimes, or it's better doctors that you could see. Where what I can offer is stuff that is definitely good. You could still see lots of very good doctors, and it's affordable. It has to be right for you. It's not right for everybody. But I'll help make that determination when I talk to you.
That makes sense, yeah.
You forgot to mention something important,
Sure.
that you don't charge anything for this.
Oh yeah, no, yeah. We charge nothing.
Thank you.
Yeah, thank you.
Yeah.
For myself, I want an explanation. Like now my kids, they have Medicaid,
Sure.
okay? I just apply, for the Medicaid for me and my wife.
Uh-huh.
It doesn't cover, too much, but I got it, okay? But, like, if I go to the hospital, for something or something like that Medicaid, doesn't cover, like the bill in the hospital.
Yes.
But they cover They cover like if I go to the specialist or something like that.
Right. It's not covering the major.
The major, yeah.
Right. Okay. Well, then if it's not covering your hospitalization, then we can definitely still help you. Okay. Yeah, you can't have both of them at the same time, though. You would have to cancel the Medicaid if you wanted to take the coverage. Yeah, you can't have two. You have to cancel one or the other.
You know, sometimes if you work with the company, you still have to. You have the company first and the medical second.
That's fine.
Yeah,
Yes.
that's fine, because if you don't, now, some staff you don't want to make it.
Exactly.
But what happened now between the kids and family?
Okay.
Because the kid is covered like for the family kids, like if you make like 40,000. But for adult family, no, he need make like 20,000.
Yes. Yeah.
What about what answer one see is same kids and adult or no?
No, what I'm offering and what I'm talking about, it doesn't matter if you're a child or adult.
If you make like 50,000,
How many people?
5 people, 5.
5 people. If you make 50,000, it would cost you $650 for the whole year.
For all of you.
So if you're between 48 and 64,000 income, it costs you $650 for the whole year total.
Yeah, the time you go to like family doctor or you go to emergency, you pay 200 or 200, 400, that's it. And after that, you know.
No. So we apply for tax credits to buy the insurance for us, right? So when the tax credits, whenever you file your taxes, you're going to have to pay back some of the tax credits because we're getting you too many tax credits. We're getting you more assistance than you qualify for. So you're going to have to return. They'll take it. If you get a tax return, they take it out of your tax return. If you pay in taxes, they're going to add this to what you pay in for taxes. So whenever to get this insurance, at 50,000, if you go over 48,000 to get the insurance, you will owe the IRS back $650. But if you receive the tax return, they take it out then.
Yeah, another question about the income. So the income depends with 1099 or W2. So with
It doesn't matter.
no like safe appointment or like
Either. If
you
you if
going with the gross or you going with the net?
so if you're self-employed, it's after your expenses, before your taxes.
Okay, after.
So if you could shave it down and get to 48, you pay nothing.
Sometimes like safe appointment, if you make like 60,000, that's gross. Plus you that's expensive.
Exactly.
You the tax at least will be between 15 or 10,000, you know.
Exactly.
So you'll be like.
I talk to a lot of truck drivers out there that make like 200,000 on paper, but once you start taking out the truck expense and you take out the insurance and you take out the gas and maintenance, you're down to 40. So yeah, it's after all the expenses.
Yeah.
Exactly.
I wish actually speak Uzbekistan language. This language here, the majority of the people here cannot speak English. They are truck drivers.
Yes.
Yeah. When somebody speaks the language.
Well, if somebody speaks the language,
Do you have Russian there?
I'm sorry. No, we don't.
Could they speak Russian here?
Yeah.
Yeah.
He'll be here for next.
No, he's leaving tomorrow morning.
I'm leaving in the morning.
Because he was here this Friday. Yeah, he was here.
I was here
Yeah,
yesterday.
yeah.
Uh-huh.
Did you get some people? Here?
Yeah. No,
Yeah.
I helped some people.
Yeah.
Okay.
Yeah.
But the,
So, do you have like website or something
Yes.
like that before I can go home?
Yes.
And read what?
Yeah, that's our imam in order to put in the.
Yes. We have a website.
Read, everything, before we decide to do any.
Sure.
Okay?
Yeah.
Okay.
Yeah.
Because like this guy right here, Arabic, he doesn't understand English. So but he wanted to take it to his son, and he can read it.
Yeah.
But he can explain to him.
And we have many Arabic speaking in my office.
Okay.
So I have lots of people in my office, different dialects too.
That's fine. Yeah, we need something like that so we can be sure what we're doing.
Yeah.
We need health assurance.
Sure.
Yeah.
Yeah. Where are you from?
I'm from Morocco.
Morocco?
He's from Egypt.
From Egypt? Okay.
Egypt.
Yeah.
This is tomorrow.
Okay. I hear really good things about Moroccan food.
Yeah, but they have Palestinian, they have Uzbekistans, they have Tajikistans, they have Pakistanis.
Yeah.
Too many, nationality.
Sure.
That's why, like, you know, we can make sure we're
Look,
gonna go to that room, to this,
Yes.
and the and see what's going on. And that time we can.
Sure. Yeah, we have at my office we have Egyptian, we have Palestinian, and we also have.
Okay, this is the phone number. What is the?
Yes, it's the same phone number.
It's the phone number,
The girl
okay,
that answered
okay.
the phone speaks Arabic.
Okay.
She's from Iraq.
Iraq. Okay. Okay. Okay.
There's no website or more.
There's no website. So our website is Marketplace Insure. That's INSURE.com.
Marketplace in Amhasa.
Mm-hmm.
Okay.
Website, excuse me, sir. Do you have a website? You can download for him the website. He can go to the website and
I can always.
no website for this.
Oh.
Yeah, so it's at marketplaceinsure.com. That's our website. It's not on there. But if you have a pen, you can write that.
www. Thank you very much, sir.
Mention that slowly. The website.
Sure.
Write the website
Sure.
right here, just to make sure for that guy, if he can give it to his son, just
Yeah.
as I do.
So our website is
Marketplace.
marketplace INSURE.com. Marketplaceinsure.com.
Is that the code here is scanned?
Yeah, so that code will take you to the application where you put in your information and somebody will call you back.
Okay.
Insure.
Any other question?
Yeah, no, thank you for having me in here.
زين هذه زين خليها تشوف الدراري توهم
Brother and sister, please inshallah apply as soon as possible. And mashallah, the office, by the way, I know everybody in the office over there, they're really helping everyone. And all kind of languages. Inshallah. Yallah, assalamu alaikum, and thank you very much.
Oh, thank you.
Thank you.
It was always good to see you.
Assalamu alaikum.